If you've got a man in your life, you can't afford to miss this segment. Testicular cancer is one of the easiest cancers to detect, and if you get it early, it's curable, almost always. The way you catch it is with a testicular exam. So let me explain what we're looking for. So they've got a sperm cord here, and then the testicles are this little soft structure down in here. And of course, normally it's in a scrotal sac, which covers this, so you can't actually see this, but it's what's underneath there. When you have a cancer, unlike these smooth testicles that don't have any lumps on them, it'll look like this. I don't know if you can see this well, but hopefully you can appreciate that if I were to put this inside of your scrotum, if you're a guy, you'd be able to appreciate that it's quite a bit different from this. And you actually can feel the lump in there, which is what, again, you're looking for. Now, if left unchecked, and this is the problem, these can get quite large. And if you can see how large this is, you'd be appreciative that you don't want it to go this way. Now, again, the good thing is when you catch these in time, you can almost always cure them. So to help figure out how we're going to catch them, I've asked Engin and his wife, Winnie, to come help us do a self-exam. How are you, Winnie?
Good.
Pleasure.
How are you?
Okay.
Hello,
Engin,
Doctor.
how are you?
Pleasure.
All right, so we're going to do this together. We spend a little bit of time trying to figure out how to teach this right. So let me just start off with the basic question. Engin, do you examine yourself very often?
Unfortunately not, no, sir. And even if I did, I don't even think I would know where to start.
Have you ever examined yourself?
No.
Okay. And have you ever examined him, Winnie?
Not that way. Not for that.
All right. So, just as women, we should stay on this topic probably,
Okay.
but just as women do self-breast exams once a month, right? The men have to do the exact same type of exam of their testicles once a month. You do it the same basic way. Ideally, it's in the shower because things are sort of warm then and the skin loosens up. And we debated whether we should have women examine their men. The men voted and thought not. But I'd be curious, would you think women would be open to examining their men?
Yeah, I would be.
How many women would examine their men? Oh, it's a big appetite.
Might make the relationship better.
Yes, it could help, Engin. Very insightful of you, Engin. Okay. So when you hold that, if you don't mind.
They're not this size.
They're not the size? No. But they usually are. Engin?
Mine is.
Mine is.
Really?
If you handle them like that, you're not going to examine anyone's testicles. Okay. All right. So you take the testicles in your hand like this. Okay. Now you notice there are two of them, right? And one's usually a little larger than the other. Not a big deal. Take your index and your third digit.
And I'm sorry, is that normal?
That is very normal.
Really?
And just like breasts can be a different size left and right, it's very common actually for men also to have different sized testicles. So you take your index finger and your third finger and you hold under the testicle. Why are you squeezing him so hard?
Oh. I'm nervous.
All right. Think how nervous he'll be.
Okay.
All right. So.
Tell me about it.
So those two fingers here, and the thumb is here, and you gently, when you use the operative word here, move around, and you're looking for a little bit of a lump there. Okay? There we are. That's it. You're not massaging it. You're looking for a lump. Good.
Okay.
All right, so you actually push a little bit and sort of palpate it, and you're looking for something that would remind you of that little hard mass I showed you there. Okay. And then you do the other side, same thing, and you move around. You're looking for something. Again, you're going to do it the exact same time every month. That way you have a standard, and you won't forget. When women, you do it the same time in the month for the purpose of taking advantage of the hormones. But the guys, it doesn't matter. It's just a matter of remembering. So can you examine Engin, you think?
Yes.
Engin?
Right now?
No, not now. No. This is going the wrong way. All right. Now, if you find a lump, what do? Call the doc. 90% cure rate. You can call me too, but 90% cure rate. All right. Now come on over here. I'm going to show you something. That's sort of the basics. Now, there's three other things that are much more likely that you'll find, and I don't want you panicked if you find these things.
Okay.
So the first has to do with something that accumulates fluid, and a lot of guys will have trauma when they're playing sports or just doing stuff, and that blow below the belt will sometimes lead to swelling. It should be temporary swelling. It should get better over a couple days. But if it doesn't, it could be this. This is a hydrocele, and a hydrocele is a fluid-filled sac, and the way you can tell is you actually turn the flashlight on, a small light, and if you put the flashlight to it, you see how it's translucent? You can actually see through it?
Right.
Mm-hmm. All right? Now let me compare that to if you had a testicle like the one we showed earlier. See, nothing goes through there. There's no light there. When you put the light in there, nothing goes through it. But if it's a hydrocele, because there's fluid there, it'll light up.
Okay.
Right?
Interesting.
All right. The second thing you want to look out for are veins. Do you have any veins on yours? Have you noticed?
Yes, there are.
Yeah. Where are the veins?
Oh, you mean like on the testicle itself?
Yes.
Oh, no. I'm sorry, I thought you just meant in general.
Where are there veins?
You know, I mean, they're there.
On the penis.
On the penis, on the shaft.
And again, that's an erection. That's different.
I'm sorry.
We're talking about the testicles here. My goodness. How long have you been married? Are you married? All right, don't answer.
Okay.
All right. So, it would look like this. You see how this looks like there's a bag of worms in there?
Yes.
And this is called a varicocele. And just like you get varicose veins in your legs, women often will get them,
Right.
you can get varicose veins in the testicles. And they have that little texture. Go ahead and palpate that. You feel sort of like the little lines in there?
Is this abnormal?
It's abnormal.
Thank God.
The only reason it's a problem is that the blood pools in the testicle and it warms the testicle. And the reason the testicles are outside the body is to keep them cool because the sperm don't want to be hot. And so if you have a hot testicle, it won't make sperm normally. So I know many cases where you'll fix this and a guy will get fertile who was having infertility problems before. Again, it's a simple little thing to watch out for. And then finally, hernias. Now, a lot of people think about hernias as being in the belly, but it actually occurs quite frequently in the scrotum. And it will look like this. And it'll be a little bit enlarged compared to the normal. And then when you cough or bear down, periodically, watch this little area here, the intestines will pop through there. You see that? And that's what a hernia will look like. Then, if you relax or can, with your finger, push it back, go ahead and push that back, Winnie. Push that back there. And it will sink back in again. So something that goes up and comes down like that is a hernia. You want to fix it because if the intestines were to come out and get stuck, then they could die. So you wouldn't want that.
No.
So we got lots of reasons to examine yourself tonight. Is that what you're going to do?
Yes.
We have a lot of planning to do.
A lot of planning to do. Winnie, thank you very much. Engin, it's a great honor.
Thank you for watching. Don't forget to subscribe and turn on notifications so you never miss out on new videos to live the good life.